Hey everyone, welcome back to another interesting and incredibly amazing episode of Living and Loving with yours truly, country music singer, songwriter, recording artist Monique McCall. And today I have an incredible guest with me. I mean, unbelievable, unbelievable doctor, Dr. Paul Michael. He is the medical director of the Palm Beach Heart and Vascular and also the JFK Wound Management and Limb Preservation Center, a world renowned pioneer and in advanced minimally invasive endovascular procedures. And he is saving lives and limbs. So thank you so much for joining me today. I normally don't read from the paper, but boy, that was a lot of technical terms.
No problem, Monique. No problem. Yeah, actually, the entire career comes into being able to take, complex things and make them simple enough for people to understand so they can join us in helping fix themselves, actually. So it's excited to
Yes.
be here.
And I really want to get to that with you.
Hmm.
But first, I wanted to start and say that you are out, you're living and loving in the medical
Absolutely.
world.
Every day.
And truly living and loving, which is really uncommon in your profession. And in reading more and learning more about what you're doing, I read that in your approach, you have a very special formula in treating your patients. And that not only includes intervention, but it includes two very other important elements of empathy and compassion that I clearly know, being a patient myself, that it's something that's lacking.
Yeah. I mean, it's lacking, and it's something that people go into medical school and this healing career wanting to be able to practice more of. It just sometimes the system doesn't allow for much of that. And I think a lot of people in the career path when they become physicians end up finding ways where they can go back to their calling, which is healing. And being able to incorporate more empathy in everything that we do in medicine is just it's so important. I grew up watching a veterinarian and a family care practitioner, primary care doctor work. And so seeing what my dad did with animals and how he treated animals and seeing how my mom treated families and human beings, I put those two things together and now I fix people.
And boy, do you ever, I understand that the approach that you take is very, very different from the traditional approach. And you have helped so many people that were in positions where they were going to be put into the surgery room needlessly.
It's a difficult situation, and that's why part of my passion is in educating others on these techniques. Unfortunately, we do have another major pandemic going on, but people don't know about it, and it's one of preventable amputations. So
Mm-hmm.
essentially, fueled by diabetes and blocked arteries, known as peripheral arterial disease, which is
Yes.
caused by atherosclerosis. Many people in this world, it's actually one every 30 seconds, somebody's losing a limb unnecessarily to diabetes. So, and we're facing that pandemic here too in this country. Obesity is on the rise, and so is diabetes. Put
Mm-hmm.
the two together, you get diabetes, and it's a pandemic. It's actually endemic now, and so with those numbers growing, we are actually unfortunately seeing more amputations happening in this part of the world as well. And something can be done about it, and I feel like it's my job not just to treat it, but to raise awareness for this disease process because what's most important about it is that it's preventable. And if it's preventable, then we can work together to do something about it.
Well, what is your process of when a patient comes into you that has, what is it, peripheral artery
Hmm.
disease?
Well, the most important thing when any patient comes in here is that we treat them like a human being.
Mhm.
And I do things a little bit differently. And what that involves is being able to sit with somebody and getting to know their story and recognizing who they actually are. And I think that's about at least half of what I do. The rest of the medical portion of the traditional treatment pathway um, is the intervention, is the diagnosis. But more importantly for me, I like to get to know who they are first. And then when I do educate them, I make them part of the team. That way they're involved with the process and they
Mhm.
can actually feel like they're doing something about their own body and they have somebody encouraging them along the way.
Mhm.
But most of the patients coming to me either have leg pain or they have wounds or ulcers that
Mhm.
are not healing in their legs. and so they're facing amputations. And we essentially unblock the arteries in the legs that are contributing to the problem. And we have a multidisciplinary wound management team. And so we heal the wounds, we open the arteries, we get them back to function so they can live their best life.
So what does the intervention incorporate in unblocking those arteries? What does that look like?
Sure. So again, back to the veterinary part, when you take an animal to a veterinary office, they have a clinic, they give vaccines, but they also operate and they can manage the animals and they give them back to you. And hopefully, the animals are in better condition than when they went in. And so essentially, we've built a multidisciplinary facility here. It's an outpatient surgical center where we can see patients in the clinic. We can evaluate them with all the medical imaging they need. And we actually have a surgical operating room in the back of the facility where we do all the procedures and a recovery area. And what the procedure essentially entails is using the most advanced, minimally invasive techniques. So no knives here. We use small needles and wires to enter the arteries and unblock them with many different techniques so we can get that precious blood flow all the way down to the feet so they can avoid amputations.
And what is the success rate on that?
So it depends where you go. So we are an amputation prevention center, and so we are facing the end stage of this disease. So we have to have a good success rate.
Yes.
And we don't have the option to tell patients no. So again, that's what makes it so important to have advanced techniques, but we definitely have the best success rates in the area for these patients, and people know that, and that's why we pride ourselves in being able to offer people advanced options.
So you know that there's a dark side to medicine. Why is there such a dark side? Why is
Well,
this?
I'd like to start off with saying where there's a dark side, there's always the opportunity for light, right? I always
Yes.
like to focus on the positive
Yeah,
and keep
likewise.
it there. So why is there? Well, because everything, whether it's medicine or politics or education, I mean, what are we really dealing with? We're dealing with human beings.
Yes.
And when we deal with human beings, we're dealing with human behavior. And when it comes to behaviors, then we look at, what are the needs of those people. And, there's always a maladaptation to any process as long as you mix people in there. That's why I love studying animals. So
Yeah.
when you have maladaptation to whatever the survival or physiologic needs are or social needs, that tends to pretty well predict what the how much darkness and where it's coming from is going to be, and then that allows you to point the light in the right direction.
Yeah, well, I just feel, even from my experience, I had a friend of mine who had a lung issue. He had a spontaneous pneumothorax, and they wanted to operate on him instantly. And I feel often that in this country, we send people for unnecessary surgeries. And if I didn't advocate for him, they would have done the surgery. And I feel needlessly now, because he's a young enough guy in his 40s, and it'd be better for him to have the free floating lung than to have it attached to his chest wall, because he's very active. And, you fall off a bike or a motorcycle and that could be it. Your lung is shred. But why is it that in the normal medical community in this country, that we offer the option always as surgery, and not options and procedures like yours that will allow for the best lifestyle going forward?
Yeah, I mean, I think it's a great question, and a lot of people do want answers to those questions, and I think I give you credit for bringing it up, but I think most people are doing the best with what they have, at the time. And so there's that aspect of it, but there's also a lack of collaboration, I think, in the medical community. And I think outcomes and patients can benefit so much more from people collaborating across disciplines, sharing information. And so there is an issue, in the country. It's known as malevolent benevolence, and it's essentially what you're describing. So that has to change, absolutely.
So
But one way we can do
how
that
do we make
together
this
is
happen?
by,
Yes.
well, we can do more education and raise more awareness. And also, we have to empower people to take ownership of their wellness. We can't expect a healthcare system to take care of us. What we have to be able to do is know just enough so that we can hold ourselves and a system accountable, instead of waiting and then relying and hoping that somebody will do the right thing for us. So I
Yes.
think we've reached that time, I think, now, where there's been enough let's say, exposure to inaccurate science and growing, data in medicine, where people have to start to realize that it's time to take charge of your own health care.
Yes, it definitely is. And I don't know who is sharing that message, but certainly no better time than now. So now you mentioned your father
Hmm.
and said that a lot of what you learned and your pathway was paved for you by way of growing up in a household with a father who was in a veterinary medicine.
Hmm.
Tell me a little bit more about that.
Sure. So, from a young age, I was helping my dad operate, observing him, but, half of it was watching how he treated animals,
Hmm.
and the other half was watching how he treated the owners of these animals,
Hmm.
and being able to see the entire spectrum of emotion, as people are dealing with pets, and it's just fascinating. And I learned more psychology and psychiatry in that office than I did in medical school. The reason being is people have such a special relationship with their pets, whether
Hmm.
it's good times or bad times, and to
Hmm.
see how he would interact with the owners to console them, to deliver news, and just customer service. I mean, it was invaluable to me.
So, how much of that plays a role? I know there's the intervention, which
Hmm.
is crucial, a crucial part of the
Yeah,
healing. But how much of a role do you think that the compassion, the empathy plays in the
I think
healing?
it's invaluable, because part of the, my own definition, and through all the research I've done and speaking about empathy, is that it involves, and compassion as well. It involves not just a desire to want to do something good. It requires a emotional and intellectual understanding of what
Hmm.
that person is going through. Then we need to be able to be moved to do something for that person, but it can't just be something, it should be the right thing. And that's where the discernment comes in. And it's very easy to see that in a veterinary office, because if something is wrong with an animal who can't advocate for themselves,
Hmm.
something's wrong. That pet should be able to go back to their owner, right? You should be able to do the right thing, and the owner is going to know. If a pet goes back home and something is still wrong, then there's an issue there. And so, doing the right thing should never leave our practice of medicine. And somehow, as you brought it up, it can. And so, watching him do the right thing all the time in animals, how could I do the wrong thing with people?
Hmm.
And so that's where that relationship was.
And how can we do the
Important.
wrong thing in general? I think doing the right thing is across the board in even the practice of life.
Hmm.
And when you do the right thing, you'll have the right results.
And then the results speak for themselves. So
Mhm.
that's another issue, is that patients, in advocating for yourself, if you can't distinguish between results, if you can't distinguish between outcomes, then it becomes very tricky to hold anything accountable. So I think we do have to have a better job of educating ourselves about basic health care
Mhm.
and our own wellness.
Yeah, I think healthcare begins at home.
Absolutely.
Yes, and I see that that is another one of your goals is in giving back is that you want to educate children so that they have this understanding early on.
Absolutely. Because why wait to become a patient to be educated?
Hmm.
It just doesn't make any sense to me. So, kids know a lot of things, and I think one of the things that we can definitely introduce to them earlier on is basic medicine, basic health care. This was being done 100 years ago. Booker T. Washington started National Negro Health Week,
Hmm.
and it was one of the most amazing campaigns this country's ever seen. And basic hygiene, basic health care, a lot more than that. But he was advocating for all these things as a class of people was learning how to develop foundational skills to build up the community. So we've lost a little bit of that, and I think we need to get it back.
So what does the Dr. Paul Michael campaign look like?
Dr. Michael campaign. Well, it looks like being the most responsible educator in a healing profession that I can, and giving anybody that's in front of me my very best every time.
Mhm. And you accept every patient who comes in.
Absolutely.
I admire you for that.
I often tell people we'll work for wounds. So obviously there's a lot of people that have payer mix issues and all that, and we always get it sorted out. So a little
Thank
bit of
you.
well, my pleasure. A little bit of a maverick in that sense, but I don't let the system get in the way of doing the right thing. And unfortunately, our country, we have to navigate, insurance, waters, and healthcare access waters, but there's always a way to get things done.
Absolutely. So now your father played a big influence in your life as far as your career, and where does mom come in?
Well, mom was a primary care physician, so
Okay.
I always joked amongst the two of them that, Dad, I want to do what you do, but in people.
You were destined to be a doctor.
I
That should
mean,
be the title of your book. Have you written a book yet? Destined to be a doctor.
thanks. Not yet. A lot of articles, but not a book yet.
Yes, and I read many of those. It's absolutely fascinating, and I've
Thank
always
you.
found it very fascinating, the procedure where that you can go in with using wires and watching on the screen. I have a friend of mine who does that as well. I don't know if you know him, but Dr. Chris Zylak
Mm.
out in Washington. I'm not sure if you're familiar with him, but
No.
he's been doing this for a long time. So
I
I
mean,
had
the procedure itself, is known as angioplasty, and the first one in this country was done in 1964.
mhm.
The technology has become so much more advanced, but it's still the same principle. I mean, being able to enter an artery, and while a patient is fully awake, and open that artery up and relieve the blockage, so they're either not in pain, or being able to heal their wounds. It's a remarkably advanced but now simplified procedure, which can be done extremely safely for anybody who needs it.
And what is the time frame on that
It
predominantly?
depends on the complexity and how many vessels we have to do, but anywhere between 30 minutes to, let's say, 2 hours for an extremely complex case.
And is there any recovery time?
Yes. So the recovery time, these are all outpatient procedures that we do here in our facility, but recovery for the patients is between 1 and 2 hours. So I don't have any overnight accommodation. So I have to be able to do a good job and get them home in better condition than they came in. So the pressure's on, but it's our passion.
I bet there's a lot of pressure in that. So tell me your best success story.
Um, we had an incredible case recently where a young woman was facing amputation. She had, I believe, 14 previous medical procedures in the same space, attempting to reestablish blood flow, and we treated her, and we got her wounds healed in combination with podiatry and myself, and she was able to actually go to Disney and walk a 5K.
Wow.
So just an incredible process. She's like family now, but essentially being able to look at somebody and say, we can do something for you, but we need you to work with us. We'll do our procedure, and you need to stay with us and follow up in clinic and get the wound care done. So we were able to get the arteries open, again, after 14 unsuccessful procedures at other facilities and hospitals. And she was able to go to Disney and run a 5K. I mean, it's an incredible story. And she was in jeopardy of losing her limb. She was told multiple times that nothing else could be done. And she's right here in our community. So
And how did she find you?
she found me through a podiatrist, her wound doctor.
Mm-hmm.
And then she also independently found me through a patient support network online. So by educating people, they've essentially created a loving support network online through Facebook, and they reach out to try to get their friends help. So we get patients from all over.
Well, good that is out there and available. And I know that my listeners can find you at the palmbeachheartvascular.com, or you can be found by phone. And I was like, okay, this can't be true. This can't be your phone number.
Sure
But
is.
I had to go make sure I checked it out. It's 561500 legs.
That's it. 500 legs. If you're creating a grassroots movement to educate the community and the public about what you're doing, you got to make it simple, like you said in the beginning. So 500 legs.
I love it. I absolutely love it. So I am so incredibly stoked that you joined me today. I know that you have a very, very busy schedule.
I'm
So
happy to be here with you.
before I let you go, I always ask all of my guests one question. Being a country music singer-songwriter, I always like to know, what is the one song that speaks to your heart and sums up the essence of your being?
So I'm a huge music fan, and that is a very hard question to ask me, but
if I asked you something about the heart, you'd answer it. The other heart, the other.
I'll tell you, there are so many Queen songs that
Mhm.
resonate between what my patients are going through, fighting the status quo, doing the right thing, struggling, pioneering a field in medicine where there's so much resistance and, a lot of psychological issues like you kind of brought up. But I mean, Under Pressure, Break Free, I mean, you name it, there's just, so I play a lot of music in my meetings and my talks,
Yes.
for inspiration and also to drive the message home. But
It's also very healing.
absolutely, music is very healing process. But I'm Still Standing is another one, Elton John. I mean,
Oh,
it
that's a great
pertains
song.
to people being able to keep their legs, right? And so
Mhm.
two legs are better than one, and one leg is better than none. So
Very, very true. And you always have to have a good leg to stand on. So, and you are helping people, one at a time to do that. And we are so grateful to have you in our community. And
One Foot in Front of Another is another awesome song.
it is. You want to sing some for me?
No, not right now.
Not right now. That's later. That's on the drive home. Well, thank you so much again, Dr. Paul Michael. I mean, saving lives, saving limbs, educating everyone. Get out, live, love. Remember, in the words of Dr. Paul Michael, don't let the system, but really don't let anything get in the way of doing the right thing. Again, you can find Dr. Paul Michael at the Palm Beach Heart Vascular. It's Palm Beach Heart Vascular.com, or give him a call at 561-500-LEGS. Everyone have a beautiful, blessed week. Get out again, live, love, keep doing what you love and loving what you do. I'll see you real soon. Thank you so much again, Dr. Paul Michael. Have a
Thank
beautiful,
you.
blessed day, and
You too.
keep saving lives.
You got it.